歡迎大家出席今日嘅。
Welcome to the press briefing. With us today are Dr. Albert Au, Principal Medical and Health Officer from the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Au will first brief us on the cases. Good afternoon. I will now report the latest information on COVID-19 from yesterday. Yesterday, the number of there were 221 PCR positive tests. 50 were detected through the HA, 36 were detected through the public health laboratories. The remaining 135 were detected through private laboratories. Yesterday, there were 208 cases who tested positive via rapid antigen tests, and these cases were declared on our platform. Yesterday, altogether, there were 429 positive cases in Hong Kong. Since the fifth wave started, Hong Kong has seen a total of 1.18 million cases, including 744,649 positive PCR tests, 444,580 positive RAT tests. Of the positive cases yesterday, 19 were imported. The remaining 410 were local cases. Of the 19 imported cases, 15 were detected via the temporary specimen center at the airport. The results came back positive. 4 of the cases were arrivals via flight OZ745 on the 23rd. 3 were from Korea and 1 from the United States. Another 5 cases arrived in Hong Kong on April the 23rd via QR818. 1 passenger was from South Africa, 2 from Italy, 1 from Germany, and 1 from UK. For the remaining 6 positive cases detected via the airport, 3 came from Singapore, 1 from Australia, 1 from Vietnam, and 1 from Armenia. For the remaining 4 imported cases, they were detected at quarantine hotels. 1 of them tested positive via PCR on the 5th day, and 2 tested positive on the 3rd day. Another tested positive via RAT on the 5th day. They came from the UK, Canada, New Zealand, and Switzerland. In terms of genome sequencing, the public health laboratories carried out genome sequencing on 116 samples. The L452R strain was not detected. 115 samples tested positive towards L452R. For the remaining case, the viral load was inadequate. In terms of residential care homes, yesterday there were no new cases from residential homes that did not see prior cases, and 6 residential care homes who had seen prior cases reported new cases yesterday involving 7 residents. 1 RCHD, which had seen cases before, saw a new case yesterday involving 1 resident. Today, there were no new cases from school since it is holiday. In terms of fatality cases, altogether, there were 9,036 fatalities, up 63 cases from yesterday. The fatality rate remains at 0.76%. For elderly people aged 80 and above, the fatality rate is 10.43%. In terms of the breakdown by vaccination status, among the fatalities, 88% were unvaccinated or only received 1 shot. Only 12% of the fatalities received 2 doses or more. In terms of the fatality rate among the unvaccinated, the overall fatality rate is as high as 3.03%. Among those who were vaccinated, for those who received 1 shot, 2 shots, or 3 shots, the fatality rates were 1.02%, 0.16%, and 0.04% respectively, or a difference of 76 times. For elderly citizens aged 80 or above, For the unvaccinated and those who received 2 doses or more, the fatality rates were 8.87%, 0.05%, or a difference of 18 times. Starting from today, the World Vaccination Day or Week of the WHO begins. So I call upon the public to support this campaign. The campaign seeks to encourage vaccination, to offer protection to people of all age groups against diseases, including COVID-19. The theme this year is that vaccination would boost longevity. Vaccination allows us to live healthier and longer lives. Over the past 3 months, Hong Kong has seen a severe situation with the Omicron strain, and we now learn much about the importance of vaccination. Many countries around the world have established that the vaccines are safe and are effective in preventing severe cases or deaths. So the CHP urges those who are unvaccinated, especially children and elderly, to act swiftly, and they should book vaccination appointments as soon as possible at community vaccination centers or with private doctors. That way they can enjoy sufficient protection before the next wave of the pandemic arrives. Apart from the COVID-19 virus, we should not forget other communicable diseases such as measles, smallpox, etc. The Joint Scientific Committee under the CHP made recommendations on the vaccination program of Hong Kong. They recommend babies and children to receive different vaccines at different stages as well as booster shots. We remind parents to bring their children for vaccination on a regular basis. For maternal and children health centers will continue to provide vaccination service for children under the pandemic. The school children vaccination group under the CHP will continue to offer advice. The MCHCs will offer temperature screening, and it is recommended that the number of accompanied persons be limited in visiting the MCHCs. Dr. Ho will brief us on the situation at the HA. 2015 hospitals are staying in the public hospitals: the Northland Hospital Infection Control Center, HA Infectious Disease Center, and the Asia World Expo Treatment Facility. Yesterday, 2 patients were in critical condition, 1 in serious condition. 16 patients in critical condition are staying in ICUs. There were 13 fatalities reported. 2 male patients passed away on April the 22nd, including a 74-year-old and 89-year-old patient. Another 11 patients passed away over the past 24 hours, including 7 males and 4 females, aged 31 to 89 years old. Of the patients who passed away yesterday, 1 came from a residential care home, 6 had no vaccination records, 1 received 1 dose, and 4 received 2 doses. 9 were age 65 and above. 2 were relatively young patients. One of them was a 31-year-old male patient. He has colon cancer, and the cancer had spread to different areas, including his liver. He was a terminal cancer patient, and he had a preset medical instruction. And on the 22nd of April, his condition deteriorated and was admitted to the A&E ward of Caritas Medical Center. His condition did not improve, and he succumbed in the morning on the 23rd of April. Another patient was a 57-year-old male. He had diabetes, but he did not follow up on his condition. So his condition was not under control, and on the 1st of April, he was admitted to PYNEH. He had a wound on his ankle, and he suffered from meningitis, and we performed 2 surgeries to in an attempt to remove the malignant cells, but unfortunately the patient passed away in the morning on the 22nd of April. Over the past day, 259 patients recovered, including 169 who were discharged. Another patient tested positive during the in-hospital screening. 2 patients in the same ward were listed at close contact. Altogether, 22,221 HA members tested positive. 21,643 have recovered and returned to their posts.
So now it's time for questions. So please, before you ask the question, introduce yourself. Gentleman at the back, the last row, from Cable TV. I want to ask about the experts' estimate that 3 weeks later, the daily infection count could be less than 3 digits, so the social distancing measures could be relaxed. Are you optimistic about that? At what situation or which indicator or number of infection cases would be considered safe for relaxing the rules? And also, for AstraZeneca, there are 190 doses arriving in Hong Kong. How many doses will be expecting, and would they be reserved for patients awaiting organ transplants? And also the 54-year-old patient concern that you mentioned. Can you give us more on whether there's any direct relationship between his death and COVID-19? Is there any direct relationship? Thank you for your question. On the first question, and later on, Dr. Ho could answer your question on the drug. In the case of our current pandemic, every day the number of cases has been stable so far, and it has been slowly coming down. But right now, every day we've got 400 to 500 cases, so that's the high level. So in the coming days, we need to continue to monitor the situation and on various indicators to gauge how the pandemic is going on, and then we can decide when we can relax the distancing measures. So the government will closely monitor the situation. And we just had a long weekend, and there is also another holiday coming, a Mother's Day, not far away. So I hope that the public can continue to observe the social distancing rules, and also they must wear masks when they're out so as to avoid any chance of a rebound in infection cases. And we just had a long holiday, and now, 5-6 days have passed since the Easter holidays, and we haven't seen a rebound, but we still need to observe for some time because there could be a longer incubation period, so we may have more cases later on. We'll continue to monitor the situation. As for AstraZeneca's COVID antibody drug, our experts have studied it. Mainly, the drug is a preventive medicine. Our experts propose that mainly they should be administered to people who have undergone organ transplant operations, for example, bone marrow transplant, or people with born with weak immunity. So if there are patients who can be fit for such medicine, we would administer it to them, and we also monitor the effectiveness of the drug. And when the time is right, we would purchase the stocks, the drugs as part of our stock. The 57-year-old case you mentioned, for all the death cases, we have an expert panel looking at the situation. For this particular case, we found that on April 1st, when he left his deep saliva sample, CD value is 29. We administer oral drug to him, but what happened is his disease was at a advanced stage at his ankle. His fasciitis case and the situation was quite serious. Next one. From Now TV, I want to ask about Dr. R, what he mentioned yesterday, that in the past week, every day the daily toll was about 500 to 600, and now today the number has come down to 400. So are we expecting a downward trend? And how would you evaluate the future trend? And also, as for the AstraZeneca drugs, have you started administering the drug to patients, and what is the effect? And how long you've said you don't know the exact number of people infected in Hong Kong? Do you think now that we are seeing a downward trend in number of cases, do you think we're in a better situation to gauge the actual number of infected population in Hong Kong? Do we have enough to actually have sufficient immunity across the community? And every day we still have 40 blocks designated for lockdowns and testing. So is that the maximum limit? And what about the overall situation? Any new cases that could come up? As for the pandemic itself, as I said earlier, in Hong Kong right now, every day, the number of infection cases, it is coming down slowly. Now, today, the figure is about 430. Right now, you can see that the pandemic has stabilized and cases coming down, but we think that in the days ahead, or 1 to 2 weeks, even though there's no rebound, we anticipate that the cases will remain to be in 3 digits. If there's no rebound, and looking at the current trend, the number of cases will come down in the end. As for your second question, the number of infected population. Earlier on, some scholars, experts, and universities have carried out studies based on their mathematical modeling and assessment. They come up with an estimate of the infected population in Hong Kong. But ultimately, we will not be able to accurately know how many people were infected because Omicron virus actually cause very mild, even no symptoms among some infected individuals. So there's no way, these people might be diagnosed. So some people have estimated there could be an infected population of up to 4 million, but we would not be able to really know the true number. As for how many people now have the immunity right now, it all depends on the number of people vaccinated and their doses of vaccination. Based on the suggestions by the expert panel, people should have 3 jabs, and for people over the age of 60 or with weak immunity, they should go for 4 jabs before they have sufficient immunity. Those people who were infected earlier, they would have enough antibody within them, but as time goes, their antibody level would come down and they could be reinfected. Should there's a new virus variant or variant that comes up, then the immunity may not be adequate protection for them. So we need to be cautious. So for people who have not been vaccinated or finished the vaccination cycle, they should go for new doses as soon as possible. And as for the compulsory testing, right now in the community, our PCR testing capacity is adequate. Given that, we would still hope that people who lived in high-risk buildings or who have been to high-risk premises should go for testing so as to avoid the occurrence of any cases that got unnoticed. Dr. Ho, as for AstraZeneca's new antibody drug, it only arrived in Hong Kong on the 19th. Our experts would monitor the situation, and for appropriate patients would administer the drug to them. But our experts' proposal is that they should be administered to people with a weak natural immunity and also or people who have undergone bone marrow or organ transplants. So we'll see who is actually suitable for having this drug. Next one, please.
This is TVB. Starting from tomorrow, most primary schools would resume half-day classes. Would this have an impact on the pandemic? What is your assessment on a possible rebound due to the resumption of classes? An expert from Hong Kong U believe that an immunity barrier has been created and the social distancing measures could be relaxed swiftly. What is your view on this take? And now with the relaxation of measures and the various initiatives, is there any hope to achieving 0 cases? Classes have resumed, and based on our understanding with the Education Bureau, most schools would resume classes tomorrow, or more than 500. Of course, that could bring certain risks, since children and students could gather on campus. So it is important to have risk mitigation measures in place. So for students who are returning to school tomorrow, parents should carry out RAT tests for them before they go to class. That would prevent the spread of cases into schools. But of course, the risks are still present, so we have to carry out the proper mitigation measures, and schools must report positive cases every morning. If we detect any irregularities, we could investigate and suggest mitigation measures for schools. Secondly, for children who are yet to be vaccinated, parents should arrange for them to receive vaccines as soon as possible. Currently, 65% of children aged 3 to 11 receive 1 dose, and this is certainly not high enough. For children who are infected, if they are unvaccinated, they could be more likely to experience some serious consequences, such as admission into ICUs. In terms of the question on immunity, the immunity barrier in the community would depend on the number of people who are vaccinated and whether they have been sufficiently vaccinated based on the advice of the Joint Scientific Committee and the number of people who were already vaccinated. Of course, immunity from vaccines is not permanent, so even those who are vaccinated could be infected again. So it's hard to say the exact vaccination rate we must achieve to build a barrier. Earlier, the government announced updates to some of the measures to prevent the importation of cases. As more travelers arrive in Hong Kong, the government would adopt stringent measures to stop imported cases from entering the community, or visitors arriving in Hong Kong must be subject to tests before boarding the flights, and they would have to be tested at the quarantine hotels as well. That way, in case of if we see any positive cases, they would not enter the community. Next question, please.
P News. A few English questions. Earlier on, Professor Ivan Hong said that Hong Kong should start speeding up the easing of COVID-19 measures in 2 to 3 weeks, because he estimates that the cases will drop by around 50 a day and could hit below 100 cases a day in 2 to 3 weeks, which will be the right time to speed up the relaxations. And he also said that non-residents coming over to Hong Kong will pose minimal risk to the city. And one more thing that he said is that one rule that could be relaxed was about wearing masks in public, because the natural immunity from past infections among the population and high vaccination coverage means that the chances of rebound of opening up will be low. So do you what does the CHP make of his comments, and will the authorities consider any of his suggestions? My second question is, with non-residents allowed to arrive in Hong Kong from May 1st onwards, may I ask where will they be sent to if they test positive on arrival? Second, where will they be sent if they test positive in the quarantine hotels? And lastly, what will the procedure be if they test positive in the community after arrival? So for example, after day 12, as if they become a local case. Thank you.
Thank you for your question. For the first question on the epidemic situation and also the relaxation of the social distancing measures, the government will closely monitor the latest epidemic situation based on various parameters, including the daily number of confirmed cases and other parameters such as the percentage positive among the testing in the community testing centers, as well as the percentage positive during the restriction testing and declaration operations, also the sewage results. So based on various parameters, the government will make risk assessment and on the latest epidemic situation and adjust the social distancing measures appropriately. For the second question on the immunity, as we know that people can get immunity either through the vaccination or through the lateral infection. For vaccination, they must complete the full schedule in order to have adequate protection against infection. And for persons who have previously infected, the natural immunity acquired from previous infection may decline over time, so they still need to get vaccinated. Otherwise, they will have a risk of getting reinfections several months later. So we still encourage all the people to get vaccinated as soon as possible and to complete the schedule. In the meantime, people still need to wear masks when they go outside or have any contact with other people in order to prevent infection as well as to prevent spreading the disease to others. For the third question on the management of positive cases, for all cases, for all inbound travelers, they need to have a negative pre-departure test before they are allowed to board the flight. And after arrival in Hong Kong, the government has implemented very stringent measures to prevent the positive cases from entering the community, including all passengers need to get tested at the temporary specimen collection center in the airport. And also, if they are tested positive, then they will send to the designated isolation facility for isolation. And if they are tested negative, then they need to use designated transport to be taken to the designated quarantine hotel for quarantine for at least 7 days or 14 days, depending on their vaccination history and also their choice. During the quarantine, they need to be tested every day, either using rapid antigen test or PCR. If they are tested positive, they will be transferred to the isolation facility, and their close contact will be transferred to the quarantine facilities of the government. So this will allow us to detect to prevent any imported case from entering the community. After the completion of quarantine, they still need to get tested at the community testing center on day 12. If they are tested positive, then we will investigate the case to see whether there is any possibility of acquisition of the infections during quarantine in the quarantine hotel. And also we will look at various factors such as the city value to see whether it is a fresh case or a repositive case, or whether the case actually has acquired the infections after completion of the quarantine in the community. Any non-Hong Kong residents entering Hong Kong, they have to comply with the prevailing immigration entry requirements, and if they are tested positive, then they will treat the same as Hong Kong resident, and they will send to the isolation facility for isolation.
下一位，嗰位男士。
Gentlemen, Dr. News, the government announced that from next month, it will allow non-Hong Kong residents to come to Hong Kong, and it will also adjust the flight suspension mechanism. So now with the relaxation, we can see that quite a number of people like to come back to Hong Kong. And the websites of the quarantine hotels show that, well, there have been much overbookings. So as more people are coming back, would you consider increase the number of quarantine hotels? In order to avoid imported cases, the government would actually need to do risk control. Our government cross-departmental steering committee and command center actually has already done some risk assessment in the light of the latest situation, and also the number of arrivals, as well as the number of imported cases. And also we've looked at our capacity to deal with confirmed cases and also the overall economic needs. And as a result of our assessment, we have make adjustment in our measures. The most important is to control the risks. So all arrivals in Hong Kong, as I mentioned, before they come to Hong Kong, they need to be tested. And upon arrival at the airport, they also will be tested and be quarantined at designated hotels for a certain period of time. All these measures are intended to prevent any imported cases from entering the community. Of course, we've done some adjustments in the immigration measures, but we're not expecting that there'll be no imported cases. But most importantly, once there is an imported case, we want to identify them as soon as possible and to avoid them from being actually spread to the community. As for the adjustment of the arrival precautionary measures, I think in other places around the world, particularly those with frequent ties with Hong Kong, the pandemic has eased and a number of cases have come down. And that's reflected in our arrival figures. Since April 1st, about 28,000 arrivals have come, and we found about 280 confirmed cases among them, which makes up about 1% of all the arrivals. Compared to January and March, 3% of the arrivals were confirmed cases, and so the latest figure is a drop. So that shows that the government has actually found that it is in a position to adjust the measures. The gentleman, next one. AM 730. The government's latest rule is that when people exercise, they do need to wear masks so as to prevent the spread of infectious diseases. But if you exercise and wear a mask, that could affect your ability to breathe. So have doctors advised people who are doing vigorous exercises, what should they do in order to have a balance? And also, you mentioned, Dr. Au, we may need to wait for 3 to 5 days before we can see what is the number of cases as a result of a long holiday. To the public, can you give us a more specific time frame so that people can see some light instead of keep hearing from you that you need to keep monitoring the situation? For your first question about exercising and wearing masks, of course, once you take away your mask, the chance of spreading the virus increases. When you are working out, you breathe a lot more. Breathe in, breathe out more. In high frequency, of course. And that would greatly increase for people doing exercise. If it's someone infected or silent carrier of the virus, the chance of spreading the virus would increase. So unless you are in a private premises or at home, working out at home, otherwise if you are in a public area, we recommend that you should put on a mask when working out. So Dr. Ho could supplement maybe later on. And secondly, for the pandemic, as mentioned earlier, after the long holiday, we need to, or with the easing of the social distancing measures, we need to observe the situation for some time. Right now, we haven't seen any trend of a rebound. We can say that the pandemic has slowly eased. That's a good phenomenon because it shows that right now, despite the long holiday, the pandemic has remained stable. But the social distancing measures, as you know, were only relaxed on Thursday, on the 21st, so just a few days ago. So we expect that with the relaxation of the measures, as more people are out on the streets, people go to restaurants more, and that could add to the risk of increased cases. So we need to monitor the situation. Right now, every day, from the figures, every day, that is quite reassuring to us. I think everyone's physique is different. On the whole, we do encourage and support people working out. But for general advice, if you are out working out and if you cannot breathe properly and cannot even say a full sentence, then you should really moderate your intensity of exercise and don't do over-exercise, and try to make sure you have good breathing all the way through your working out. Next one, the lady over there. Economic Times. I want to ask about the preventive drug from AstraZeneca. You are talking about 1.9 million doses. How many people can be administered with the drug? What is the usual or expected dosage for a patient, average patient? Are there any side effects of the drug, and any patients who are not fit for such drugs? And can you also tell us do you have any plan to buy more of such drug? And Dr. R, an Indonesian maid was confirmed earlier on, and you said that you carry out an analysis of her virus. Have you got the latest update, or is she a re-positive case? And for the social isolation facilities, are going to provide an additional 50,000 beds in the days ahead. And now we have only hundreds of cases a day. Do you think we can make good use or really use up the 50,000 additional beds in the new social isolation facilities? As for the AstraZeneca drug, it's mainly for people with weak immunity. For these patients, even if they've been vaccinated, because of their problem with the immune system, they cannot generate the antibody to protect themselves. So for these patients, how can we protect them? We would consider administering such preventive medicine to them. And this medicine just arrived on the 19th of April. Therefore, our experts are still selecting the right patients for administration of the drug. We also need to monitor the clinical needs and whether there's any need to purchase more of the drug. Well, the case you mentioned actually has 2 jabs. Well, we will see how patients react before we prescribe a treatment. So we need to look at the clinical conditions before deciding when or how to use or when to use the drug. On April 22nd, in relation to your second question, there was a confirmed imported case involving a 38-year-old Indonesian maid. Her virus sample has been analyzed by the public laboratory, and the sample was first checked at a private laboratory, and the result was uncertain. And in our laboratory, it tested positive. The CT value is very high, way beyond 35. Viral load is low. And the genome sequencing is still underway, so we don't have the results yet. We may not be able to finish it because the viral load is very low. And after she left the quarantine hotel, the people who lived with her are now under quarantine, and they have not been testing positive. So we thought that hers might be a re-positive cases and not a newly infected cases. As for social isolation facilities, having enough isolation facilities actually could be useful for coping when there is a rebound or when there is a sixth wave. It's very important because once we have enough the isolation facilities, then when a large number of cases occur, we will have adequate space to isolate the confirmed people. And right now the confirmed cases has come down and many social isolation facilities are on standby, but the facilities still for the future, should there be an about turn in the pandemic, they are very important.
Next question, please. The speaker is not coming through the microphone. I do not have the numbers. Next question, please. Final question. Hi, this is Ming Pao. I'd like to follow up on the recovered patients and the issue of long COVID. The number of hospitalized patients with the HA has been in decline in recent days, and more people have been discharged. Among the discharged patients, how many of them had to be admitted to hospital again within a month? And among those cases, what symptoms or after effects were experienced by the recovered patients? Did you maintain any statistics of local recovered COVID patients and how many experience lingering effects or long COVID after recovery? We know that the authorities are providing follow-up services such as Chinese medicine consultation services. And what is your assessment on the of the results so far in terms of services provided to the recovered local patients? We currently do not maintain a breakdown of the relevant recovered patients. For some recovered patients, we would arrange for follow-up consultations based on their needs. For adults, COVID mainly attacks the lungs, and some recovered patients have to receive rehabilitation for their respiratory system. For some recovered patients, they were admitted to hospital for some other reasons, and we would follow up accordingly. During the follow-up consultations or when patients are discharged, we would look at their specific needs case by case and offer follow-up consultations and treatments as needed. This is the end of the press briefing. Thank you.